Hey, thank you so much for having me today. As was said in the introduction, I am a neuropsychologist, so my interest lies in brain-behavior relationships. And my clinical and research focus is largely include understanding executive functioning, particularly in autism. So I'm very excited to talk with you all today about a domain of cognitive functioning that is very important for all children and adults, but can be an area of vulnerability for children with neurodevelopmental disabilities, including autism spectrum disorder and attention deficit hyperactivity disorder. Let me see here. Oh, there it goes. All right. So just so we're all on the same page, I want to just briefly first define autism spectrum disorder, which from now on I'm going to refer to as autism, as those terms are used interchangeably today to describe individuals with difficulties in two main areas. The first area is social communication, which includes problems with social emotional reciprocity, and that's kind of the back and forth of social interactions. So this can include trouble with initiating or beginning social interactions, having fluid conversations, sharing your interests with others, and sharing in emotional experiences, or sharing your affect, so kind of your facial expressions, or having kind of a limited interest in asking others to join in with you. Additionally, there may be trouble with nonverbal communicative behaviors, so limited eye contact or use of understanding of gestures for communication, like head nodding, again, or facial expressions, or body language, as well as difficulty appreciating personal space. Children with autism often have difficulty developing and maintaining and understanding relationships, and this can range just from difficulties adjusting your behaviors to suit the various social contexts, or difficulties in sharing in imaginative play or making and maintaining friends. The second criteria for autism includes restricted and repetitive patterns of behaviors. And so for this, I want to direct you to this picture I have here. And I took this from the window of the kitchen at our center. And what you can see is the bottom of a very large, beautiful pine tree. But if you look closely under it, you see also a beautiful line of many, many pine cones. And so as a classic early red flag of autism, lining up toys and objects is there, right? And so this is something that just really made me smile and just appreciate the kids that I work with. And while repetitive patterns of behavior certainly can be troublesome for some individuals with autism, they also, make these kids so unique. And so criteria B, these repetitive and rigid patterns of behavior, include those stereotyped repetitive motor movements like the hand slapping, the lining up of toys and objects, and also can include repetitive language. Also under this category is the insistence on sameness or inflexible adherence to routines, difficulty transitioning. Hyperfocused interests also fall within this category, so that includes an abnormal intensity or focus in one topic that can be all-consuming, and that's often to the exclusion of other topics. And these topics can change and be replaced over time. And then differences in sensory functioning also fall in this category. So that can be to pain or temperature, to sounds, to textures, to smells, as well as visuals. And that can be either a hyper or a hypo sensitivity to these sensory inputs. And so as I read through these symptoms, you can probably imagine how there could be an overlap with other neurodevelopmental conditions. So here's a list of some of the common childhood disorders that need to be considered when you're evaluating for autism. And these share some of the symptoms with autism, right? So if we think about a receptive expressive language disorder, that's going to share communication difficulties. We're going to talk in a lot of detail how ADHD shares some of the symptoms with autism. Anxiety really overlaps with some of those repetitive thoughts and behaviors. Intellectual disability overlaps with both communication and repetitive behaviors. Learning disability can overlap with some of the communication difficulties, and Tourette syndrome can overlap with some of the repetitive behaviors. Even giftedness, so can overlap with repetitive topics, advanced vocabulary, and there are others as well. And so what you'll notice here is only the title of this slide has changed, as these disabilities can also be diagnosed in addition to autism, and that's called a comorbidity. And so I want you to remember that word and what it means, because I'm going to reference back to comorbidity, particularly autism and ADHD, throughout the talk. And so while we try not to give too many labels to any individual, it can be important to provide these multiple labels, as sometimes all of a child's needs may not be fully described by a single label. So being able to define multiple needs can be important, as it can have significant treatment implications. And so a great example of this is autism and ADHD. So I want to briefly go over the symptoms of ADHD. So in the category of inattention would fall failing to pay close attention to details or sustaining your attention, trouble following through on instructions or not finishing schoolwork or chores, trouble with organization, avoiding things that require a lot of attention, losing things or forgetting things a lot. So, you can imagine this is the child walking down the hallway with the papers falling out of their backpack. The second criteria includes hyperactivity and impulsivity. And so this could include fidgeting, getting out of your chair when you're supposed to be sitting, running or climbing on things a lot, always acting like you're on the go, trouble playing quietly or talking excessively, blurting out answers before the question is completely asked, trouble waiting your turn. And these symptoms can't be kind of brief. They have to be present for at least 6 months. And so as this, one child might not display all of these symptoms, you can talk about ADHD as being primarily inattentive. So they have those symptoms in the first category, but not the second. You can talk about it being primarily hyperactive impulsive, which would be those symptoms in the second category, but not very many in the first. And then the combined type, so you have symptoms in both of these categories, and that's the most common type of ADHD that we typically think of. And so both kids with autism and ADHD have social difficulties often. And so you can imagine how these manifest, trouble making friends. But they might be driven by different symptoms, right? And so if we think about autism, if you don't talk to people a lot and you don't communicate both verbally and nonverbally, you don't seek enjoyment to share with others, you don't have that back and forth fluidity, you're not reciprocal in your play, you can see how peers might not be as accepting of you. Similarly, if you're interrupting and intruding on others a lot, you have difficulty listening when you're spoken to, you talk a lot, you can't play quietly, and when you do play, you can't kind of stay on track. You can see again how peers might not want to hang out with you as much either. And so all these things can lead to troubles socially. Similarly, you can imagine how repetitive behavioral features can result from symptoms of either one of autism or ADHD. So classically, obviously, the stereotype motor movements, the flapping, the pacing, the rocking, lining up toys, flipping objects, these all are repetitive behaviors that are seen in autism. And then if you think about ADHD, if you're always on the go, driven by a motor, you might be pacing, you might be rocking in your seat. But is that truly a motor stereotypy? You might be tapping your hands or feet. You have trouble sitting still. You can be messy or disorganized, and that kind of could resemble some sort of kind of repetitiveness to your play or your activities. And so again, we share these, we share the outcome that there can be repetitive behaviors, but they're really a different quality. And so in fact, the motor domain is another great example of where autism and ADHD can show similarities and differences. And so in a study conducted by some of my colleagues at Kennedy Krieger, children were asked to hold the handle of a robotic arm that was covered by a screen. And they used the robotic arm to play a game to capture targets. And those targets were animals that had escaped from a zoo. And so the child received both visual feedback and proprioceptive feedback, which is pressure from the robotic arm. And so on this test, they found that children with autism showed a slower rate of learning and relied more on that proprioceptive pressure feedback than the visual feedback to perform the task. And children with ADHD, on the other hand, showed excessive variability in their motor speed. So there were differences here in their performance and how they learned motor tasks. In another study, we found evidence of specificity in autism for poor catching and balance skills, which these were not seen in ADHD, which can translate to difficulty with coupling, if we take all this together, coupling visual and temporal feedback to adjust your movements. And in real life, this relates to smooth coordination and can affect how you play sports. And we know that's a big social outlet for children these days. There also are some motor similarities that we did see, particularly in fine motor dexterity, so difficulties with that, as that also relates to handwriting, which we see in both of these groups. And so I want to talk a little bit about some of these shared biological factors between autism and ADHD. And so the sex distribution, they're both predominantly male. For autism, it's about 4 to 1. There's some variability in some of those findings, but we'll just say 4 to 1, boys to girls, males to females, and it's about 2 to 1, boys to girls, males to females in ADHD. From a genetic perspective, it's estimated that about 50 to 70% of the genetic factors can overlap between the disorders, and that there's also shared differences in the structure of the brain, as well as how the brain communicates or sends signals between different parts of the brain, so that functionality of the brain. So first we'll talk about some of the differences and similarities in structure. So from this figure, I'm not expecting you to appreciate all the nuances of what's shown, but I want you to focus on these different colors. And so again, this figure shows the structural MRI findings from kids with autism and kids with ADHD. And so these green regions show where autism and ADHD show similar differences from typical measurements. Okay, and so what you'll see is in this lower back part of the brain called the cerebellum that contributes to motor coordination and balance, as well as the corpus callosum, which helps the two hemispheres of the brain communicate with each other. So though there are similarities between these brains of kids with autism and ADHD, there are differences too, and that's highlighted in blue. And so the blue highlights areas where autism shows increases in the volume, and ADHD actually shows decreases in brain volume. So this includes the prefrontal cortex, which we're going to talk a bit about as it relates to executive functioning, as well as the basal ganglia here, which has a variety of functioning, but of those include motor coordination and motor learning. And then lastly, the red indicates regions primarily implicated in autism, and that includes the temporal lobe, which is where auditory information is processed, but also the temporal lobe is involved in language comprehension and memory and emotional association. And differences were also along those lines seen in the amygdala, which is further involved in emotional processing. And so again, this slide reviews the structural differences and similarities, but there is also some suggestion of functional differences and similarities between autism and ADHD. And so, and particularly suggestion that there's some long-range underconnectivity in the communication of the brain regions, as well as short-range overconnectivity. So in other words, there are fewer long-range connections and more short-range connections. And so what that means is these long-range connections are really involved in information and sensory processing and integration, attention, socialization, and communication. They're also very involved in executive functioning. And so those are implicated in some of the challenges that these kids have in these areas. Additionally, short-range connections have been suggested to contribute to the repetitive patterns of behavior and getting kind of stuck in those details. There's, obviously still a lot of work ongoing in the neurology of autism and ADHD, and so it's likely that there's some kind of combination of these structural and functional differences that contribute to the complex variability in individual symptom presentations that are seen across the spectrum of autism and ADHD. So we've talked about some similarities and differences. Another difference is in the trajectory of brain development. And so despite some of this overlap, again, there are some differences. And so in autism, we see an early, rapid, and pervasive increase in brain size during infancy and toddlerhood, which can result in some children having larger brain head circumferences, followed by an arrested development in later childhood and a potential decline into pre-adolescence into adulthood, where there's some what we call over-pruning of connections. Versus in ADHD, it seems to be that there's more cortical maturation that's delayed several years compared to typically developing children, but that there's some kind of catch-up, that typical cortical volumes are attained by later adolescence or early adulthood. So there are definitely some differences there. So to this point, we've only talked about children with either autism or ADHD, but we know that children with autism can also have ADHD, so that comorbidity, right? And so this study, and again, not asking you to appreciate all the nuances on this slide, but this is a study that provides, information about the brains of autism and ADHD because it includes kids with autism with and without ADHD. And it relates it specifically to motor functioning. But what this study found was that there are differences in the motor circuit anatomy based on whether ADHD was comorbid or not, and that the relationship between the motor system differences varied based on ADHD comorbidity status. And so, as some of these findings actually suggested more typical brain morphology and motor performance in the ADHD and autism group, so in that comorbid group, one explanation was that the ADHD was somewhat protective, and as the brain development in ADHD is kind of more delayed rather than variable, as what we see in autism. Sorry about that. But also the comorbid ADHD group did not always have more typical brain and motor findings. It was also suggested that autism with comorbid ADHD may reflect a separate neuroendophenotype. And so what that means is a separate kind of brain behavior relationship from either autism or ADHD. So we're going to talk a little bit more about that in a little bit. But before we do, I'd like to talk a little bit more about some similar and shared behavioral factors. And so particularly, I'd like to talk about executive functioning. So executive functioning challenges are present in both autism and ADHD, and there's some evidence to suggest that those with both autism and ADHD are at even greater risk for executive functioning challenges. And we'll talk a little bit more about that after we first talk a little bit about what exactly executive functioning is. So executive functioning, I like to think of it as the puppet master of the brain, which coordinates all the individual thinking skills to work as a whole. And these are really the skills that allow us to develop from a fully dependent child to an independent adult. So again, it requires the ability to plan ahead and sequence complex behaviors, to simultaneously attend to multiple sources of information, to grasp the gist of a complex situation, to resist distraction and interference, inhibit inappropriate responses, and sustain behavior for prolonged periods of time. So that's a lot of high-level tasks, right? But it also can be separated into subdomains, which include cognitive, behavioral, and emotional regulation. So with regulation kind of being at the heart of it, how we regulate our thinking, how we regulate our behaviors, and how we regulate our emotions. And so under the cognitive piece, we're thinking about how we regulate our attention, how we set goals, how we manage our time, how we problem solve in novel situations, how we think flexibly, how we use our good judgment. Behaviorally, we got to initiate tasks, kind of get that motor going. We got to inhibit automatic responses sometimes for a better response. We have to sustain our effort. We have to control our impulses and delay gratification, and we have to anticipate future consequences. Emotional regulation includes the modulation of your emotional arousal and your mood and how you can soothe yourself. And so if we think about how all of these things can help you complete a task. And so let's take a real world example of executive functions run amok, a book report, right? And so written expression, long-term projects for school age and older children is one of the most taxing tasks demanding of executive functioning. It involves cognitive regulation, right? So you have to plan ahead for all the steps involved. First, you got to read the material, then you got to outline the report, you got to organize your thoughts, you got to physically put it in writing, whether it be handwritten or typed. You got to proofread it. So lots of steps involved. You got to turn it in, not to mention. Time management, so not spending too much time on any one of those steps, not waiting till the last minute. You have to regulate, so those are some of the cognitive pieces. Now we think about behavior regulation. You got to set the goal and stick to it. You can't get distracted by, more preferred activities, video games. And then you got to delay that gratification. So I have to do all of this work so that maybe in a week or so I get a grade back from a teacher that translates into what? Then you got to regulate your emotions. So this can be a very difficult task, right, for typically developing kids, for kids with autism, for kids with ADHD or any combination. And so it can certainly cause a lot of frustration. And so you have to put those kind of coping strategies in place throughout the long-term process so that you don't let kind of your mood and your emotions get in the way of you completing the task. So we're going to quickly go back into the brain again. And so where executive functions are controlled are, again, by those frontal lobes. So those are those areas all up here. And interestingly, our frontal lobes are later to develop as the brain matures from back to front through childhood and into adolescence and even into our 20s. And so it's the connections that the brain is refining between its different parts that allows for executive functioning to kind of do its thing. And again, that's happening from back to front. So the frontal lobes are kind of the last ones to really mature. And so as these connections strengthen over time, our brain becomes more efficient in how it approaches problems. And so this is the brain is developing in parallel to what we expect from kids. That's why we expect more planful and organized behavior from a young adult versus an adolescent versus a small child. And environmentally, we provide less support and supervision as children age, as we are expecting that they're more capable of independently managing greater responsibility. And a lot of that is due to those frontal lobes and their maturation. However, for our kids with autism and ADHD, who typically experience weaknesses and delays in their executive functioning development, we really need to be maintaining those supports instead of pulling back on them as we attempt to teach them the strategies they need to help compensate to use their skills. And then as children grow older, of course, the stakes grow bigger. So think graduation, potential for higher education or stable employment. And so, executive functioning challenges present in both autism, ADHD, and autism plus ADHD. And so for our kids with autism, these rigid and routine-bound ways of thinking. And so that certainly can get in the way of, holding down a job. If you're not going to be flexible when your boss asks you to do a task a different way, your boss is probably not going to be coming back to you very often. If you're hyper-focusing your interests and you're not kind of open to doing non-preferred activities, that's hard then to maintain employment if that's not in your hyper-focused interest. Rigidity and social dynamics. So, there's, for many jobs, there are social dynamics to manage. Even just having a boss is a social relationship as well, and so being able to flexibly manage those. And then efficient and abstract reasoning versus getting stuck in the details. So a lot of our kids, with autism can get to the right answer. They just don't kind of take the straight route. And so that can often mean they're kind of taking longer to get there. And so, in our fast-paced world with such an emphasis on efficiency, that can be problematic. And so these weaknesses in executive functioning may help explain some of the disconnect between the functional skills of children who have otherwise intact cognitive functioning. So there's a need to apply their learned knowledge in a flexible and fluid, dynamic manner. And so I know there are a lot of big words in the title of the slide, but to break it down, the question that's posed here is, are specific executive functioning behaviors linked to specific genetic changes in either autism or ADHD, so that would be the endophenotype, or are specific executive functioning behaviors linked to core features of multiple disorders, including autism and ADHD, that would be the polyphenotype, or are executive functioning behaviors a distinct cluster of symptoms that may or may not be present in either autism or ADHD, but the presence of this executive dysfunction decreases functional outcomes for those with autism and ADHD. So the short answer is we don't know yet, but this figure kind of starts us in that direction to help figure some of that out. And so what it shows is the areas of executive functioning weaknesses that are shown in both autism and ADHD and those that are shared between autism and ADHD. So what you can see in the diagram is that the autism and ADHD comorbid group, that's this kind of purpley color here, appear to share impairment in flexibility and planning with the autism group. So these are traits unique to autism or unique to autism and ADHD comorbid, and that comorbid group shares deficits in response inhibition with the ADHD group. So response inhibition is only seen in ADHD or kids who have autism with ADHD, so it's not in that autism-only group. Conversely, deficits in attention, monitoring, working memory, fluency, concept formation, and preparatory processing are shared by autism and ADHD. So the answer, again, to this question is yet to be determined, though there appears to be evidence that, there's some kind of combination of all of this going on. But importantly, identifying specific executive functioning patterns that could be linked to genetic or neurological markers in children with autism, ADHD, or comorbid autism could be important for treatment planning. And so, again, we're talking about the co-occurrence, that comorbidity of autism and ADHD, and that's only been a topic of more rigorous study lately, as we previously, technically, by diagnostic manual standards, were not able to make these diagnoses together, though we know that, there are certainly kids for which this fits. And there's some preliminary evidence to show that when ADHD is comorbid with autism, the risk for increased severity of psychosocial problems increases. The kids with this comorbid condition experience more difficulty in daily life, potentially have lower cognitive functioning and more severe social impairments. They also potentially may be less responsive to standard treatments for either disorder. The other big question is how this presents differently in the different sexes, and that's really an untapped area of study to this point. And so what does this mean for our kids with autism? Well, I think we all can relate with having executive functioning challenges at one point or another, or every day, perhaps. Our lives often demand more from us than we can handle. That, combined with not getting enough sleep, can lead to daily blunders, forgetting to buy milk or to pay a bill that isn't on a regular cycle. But for kids with autism and or ADHD, having poor executive functioning can place them at risk for underachievement, so both academically and related to functional living skills, places them at risk for increased family stress or poor adult outcomes. And so what do we do about that, right? So research into behavioral interventions targeting executive functioning in autism is ongoing. There is some initial evidence. There are methods for both supporting and improving executive functioning. And so given that a child's job, is going to school, it's important that they be provided with supports and reinforcement techniques both at home and in the school setting. Because unless these skills are practiced in different settings, they can't be generalized. So the child can't learn to use them flexibly. They'll know to use them in one setting, but not in another. Because our kids with autism are very good at learning rules, but they don't necessarily apply them flexibly when they need to. And so they have to get practice on how to apply the rule when the rule changes slightly. And the best way to do that is in different environments. And so if we start with what can be done at school, executive functioning needs can often be included and should be included in a child's special education plan. And through their special education plan, the child can be provided with individualized supports, accommodations. And I think it's important, too, that they have goals to increase these skills so we know what we're working towards. Johnny turns in his paper 4 out of 5 times when needed. It's important not just to accommodate, but to have goals that we're working to improve these skills. So some of the examples of some of the accommodations can be extended time. So again, our kids can usually arrive at the right answer, but they don't take the most efficient route. Adult support with a homework planner, so color coding the subjects and folders, having an adult check in at the beginning and end of the day to make sure that they brought what they needed to and from school, and that happens both at school and at home. Having a formalized study skills class. So this is a class that's teacher-led. This isn't a study hall like, where kids are throwing paper airplanes and sleeping. This is teacher-led. The children have the opportunity to learn ways of breaking down assignments and planning ahead for tests that have their real-time requirements of their current course load. And so, that could be a child has a particular book report, and the teacher tries to help them outline a timeline, help them check in on the timeline, and problem solve any kind of blocks that they're having. There are also lots of organizational apps that have timers and reminders, and so that takes the burden off of the parent to be, reminding the child, did you brush your teeth? Did you do X, Y, or Z? So these are, those are home examples of how an app can be used, but it can be used in a school setting as well. Did you turn in your homework? Advanced warnings prior to changing activities and subjects, again, helping with that flexibility. Chunking information and teaching mnemonic strategies, so, learning the Great Lakes by kind of having a single word that sums them all up. And again, it's important that these things need to be done both at school and reinforced at home. And while these are particularly focused on the individual, there are also school and classroom-wide modifications that can be made. And so, these are ways that you can set up an environment and set up your classroom or your school that support all students, and especially those with executive functioning challenges, so without kind of singling them out or overwhelming them. So reminding and providing time for the entire class to proofread an assignment before turning it in. So, just taking those extra couple minutes. Okay, everyone, I want you to look down at your assignment. Do you have your name on it? Double check your work. Make sure you did all the items, etc. Keeping the proximity of the homework bin close to the students, especially the students that have executive functioning challenges. So it's kind of more in their face and they have a prompt. And just posting visual schedules. Visual schedules help everybody. I could not survive without all the lists that I have and I make every day. So, a visual schedule is just a larger, fancier list, essentially. And so I want to talk about some specific programs that are available that can be used both in school and home settings. One is called Unstuck In On Target. And what this does is it provides strategy and vocabulary for teaching some of these critical executive functioning skills. So teaching flexibility, how to handle unexpected events and unwanted demands. I like to talk to families about having what I call backup plans for when the routine changes, because routines change. Routines are awesome and routines are needed because they help teach skills. But when the routine changes, we have to be able to cope with that. And so what I suggest is, you practice setting up some times to practice backup plans in a safe situation, like at home, for a low salience routine. And that way you support the child through the change in the routine when the child has a chance to practice being flexible with something ending positively. And then you kind of up the ante as the child gets good at changing those routines. Setting goals, so seeing the big picture, making long-term goals, avoiding distractions, and making and checking plans, so organizing the steps needed to accomplish a plan or a goal and a task and monitor that work. And so there are kind of some primary teaching strategies that are used, so memorizing and repeatedly using the same kind of keywords and scripts. So like I said, a backup plan. So using, a backup plan every time. So are we going to use our backup plan today? teaching by doing. So you model and you coach new scripts and skills, and you show the child how they can be flexible in particular situations. Making it fun, so rewarding the child, playing games with the child, and this program actually has games where you have to put your flexibility to work. And providing visual supports and checklists, etc., like we said. And again, this can be and should be applied both at home and in school, and typically children have to have at least about a 7 or 8 year language level to be able to really kind of grasp onto some of these concepts. Another program is called SMART but Scattered, and this targets 11 key areas of executive functioning thought to be most related to school success. And we've talked about all of those 11 through this webinar. But the one that they talk also about that we haven't specifically defined that I think is important to go over at this point is something called metacognition. And this is also something, that our children with autism and or ADHD have trouble with, and that's that ability to take a step back and assess a situation from multiple perspectives. And that includes assessing yourself and kind of seeing your role in the situation. And, this program rightfully takes the approach that this is a long-term process. These skills need to be practiced. They need to be, building on short-term goals to, having short-term goals to build upon, to have ongoing practice and monitoring. And kind of accepting that this is going to be kind of a marathon and not a sprint helps kind of everyone involved, the adults, the teachers, the parents, have a sense of patience and deliberateness in how they approach teaching, executive functioning strategies and supports. And so teaching this skill, really relies upon scaffolding. And so what that means is that you're kind of piling on that support at first, and you're starting to kind of slowly pull back as you see the child is having success. So basically, you can set up a problem, identify the behavior you want to work on, set a goal related to it, establish the steps that you're going to reach that goal, make your lists, and then get the child to start using that list and evaluate that process, how often the child is using the list. Do you have to always prompt the child to use the list, or does the child start to use the list on their own? And again, pulling back through that supervision, fading that supervision through that scaffolding piece. And there are other intervention strategies, so kind of classic behavior management strategies, so the ABCs of behavior management. So where the A is kind of that trigger, the B is that target behavior, and the C is the reinforcement, what is kind of maintaining that behavior. And so identifying those ABCs and then looking at a way to break that cycle, that maintenance cycle that's maintaining that behavior. And that includes rewards and incentive systems that can also help with not just breaking that cycle, but can help with behavioral initiation. There are also cognitive behavioral approaches that can be helpful, and these involve recognizing and challenging unhelpful thoughts and replacing them with positive thinking and positive coping strategies. Medication can also be helpful, can help with the inattention, the hyperactivity, the impulsivity, behavioral initiation. And then there are some hybrid approaches, so the zones of regulation. And again, this is designed to foster that self-regulation and emotional control. And it's based on systemizing theory, central coherence theory, cognitive behavioral strategies, as well as social thinking, visual support, self-management. So it takes in kind of a lot of these different theories and approaches that we've discussed. And then, given that all we've talked about executive functioning, you can imagine that socialization requires a lot of executive functioning skills. So you're managing multiple dynamics. You have to be flexible. You have to listen into different people and different people's perspectives and integrate that kind of in the moment. You have to stop yourself from saying something that might be inappropriate or offensive. So a lot of tapping into executive functioning involved in socialization, and so naturally a lot of our social skills programs also include executive functioning components, which is an added bonus because it gives you another setting to, again, to work on that generalization piece that I stressed is so important. And so one example is the social thinking curriculum. They apply strategies in social settings, and it breaks down those complex concepts into doable parts that can be, again, applied in those multiple settings. So I know executive functioning is a bullet on here, but really all of these things, self-regulation, social emotional learning, perspective taking, social problem solving, all of them involve executive functioning. All right, so what works best? So evidence for these approaches is growing. However, it's challenging to evaluate behavioral approaches. Treatment studies often focus on treatments that are of briefer duration, and as we already said, that that we're in a marathon, we're not a sprint here. But just by nature of doing a treatment study, that's often a logistical problem. Effective interventions also often involve multiple components, multiple child and family dynamics. And so even if some of these programs aren't kind of fully evidence-based practices, the approaches that all of the programs that I've presented today are based in practices that have evidence in their theory. And so additionally, when we think of what's working best too, the first published study of the first multimodal treatment study of children with ADHD, not necessarily autism, so I will throw that in there, found that a combination treatment, medication and behavioral therapy, was the most successful approach. And kind of the tenet behind that is that if you do have all these interfering behaviors, you're impulsive, you're inattentive, et cetera, the medication helps in the moment, and then the behavioral approach is what helps in the long run teach, again, those strategies, helps, figure out what's going to, give the child the toolbox they need to be most successful moving forward. But I think really kind of in the end, there's no kind of blanket statement of what's going to work best for every child. And so the best treatment for an individual child is best selected on an evaluation of the child's needs, which has to also be considered within the larger environment in which that child needs to function, right? So, as a neuropsychologist, that's kind of what I do. That's my role, is I'm in a good position to help determine what aspects of cognition, whether it be executive functioning or something else, is most contributing to challenges faced by the individual. And so sometimes the challenges are cognitive in nature, sometimes they're behavioral, sometimes they're both, or sometimes it's totally something else. And so, having some kind of evaluation of the child, it doesn't have to be a full neuropsychological evaluation, but starting on an evaluation of the child's needs and the demands that are being placed on the child. So again, in the context of that larger environment, is really important. And then kind of getting help. So, a lot of these things are great to get families started and to know what to ask for, supports and accommodation-wise. But, having a professional kind of coach you through this can really help evaluate from an outside perspective which techniques are working and how to modify the strategies as progress is made, because that's really important. Again, we were talking about that scaffolding approach. And so we want to make sure that we are challenging the child while not overwhelming the child. And that's, a difficult role, a hat for a parent to play, because parents wear a lot of hats. And so getting help is often indicated. So that is where I will leave you guys. I think I stuck to the time limit, so we do have some time for questions. So I will kick it back to Vincent if he wants to
Yes.
do that. Sorry.
No worries, no worries. Thank you so much. We did get a number of questions in, so I'll start with an easy one. You had on your slide, or you might have said aloud, TD. Did you mean typically developing?
I did, yes. Sorry
Okay,
about that.
all right. No worries. Yeah, someone just wanted to know. Someone was asking, so you were talking about MRI technology. Do you know of research that uses any other sort of technology to study autism and ADHD? or are you, or do you use any other technology?
Sure. There are other, yes, I did focus a lot on the MRI piece, but yes, there are lots of studies looking at EEG, which is electrophysiology. And so I didn't, review all that. There, are things called MRS and yes, so there's a very wide variety. I wanted to, I don't know that we have time, didn't necessarily have time to get into all of that, but yes, the answer is yes.
Okay. So you showed a few books and different models. Are there any apps that you would recommend? Someone was talking specifically about like organization and timer apps for your phone.
Yeah, I mean, there are a lot of free apps out there. There's one called Chore Monster. I know some classes use something called Class Dojo, and that has both a school and a home component, so you can kind of get feedback on your child's, like your child can earn points within the classroom, and then you can also set up that they earn these points at home as well. But yeah, there are a ton out there, and I guess I didn't disclose in the beginning. I don't have any personal interest in any of the interventions that I presented or any of these apps today. But yeah, there are a lot out there, and I would say that if you try one and it's it doesn't work, either your kid doesn't respond to it or it doesn't work within your family routines, try another one, because yeah, there are a lot of different ones, and maybe your child just didn't like the way this one looked and they didn't respond to it positively. And one might be more visually pleasing or, might be more motivating in a different way. So, I don't think that there's, just one out there, but those are, a couple I know about.
Mm-hmm. Okay, thanks. So a few people were asking about where they could get more information and like if they live in the area, would they be able to contact CARD to get in touch with you? If not, if they live somewhere else, where do you suggest kind of that they search for someone that can help with ADHD and autism specifically?
So, I think most large medical centers have departments either of neuropsychology or developmental pediatrics or behavioral psychology. All of those professionals really, evaluate and treat autism. They're definitely outside of academic medical centers. There are people that have private practices that also specialize in these disabilities as well.
Mm-hmm. Okay. And for parents that, so as you mentioned, there's an overlap between ADHD and autism. For parents that are seeking, so maybe they got a diagnosis of ADHD, but they might be seeking an additional diagnosis of autism. Where might you point someone that's in that in-between area?
So typically I would recommend that they see someone that is specialized in diagnosing autism, because that, I think, is a very kind of tricky intersection of if you have any kind of combination of autism, or I'm sorry, take that back. If you have any combination of ADHD, anxiety, language, learning disability, basically take that slide I showed you with the zebras and the giraffes. If you kind of clump 2 or 3 of those together, you can very easily present like you have autism. And it's an important distinction. That person may have autism or that person may not have autism. That person may have kind of a cluster of those, other things, or they might have autism, or they might have autism and those other things. And so, it really does, make a difference on how we treat, what treatment programming we develop for a child For instance, we may, a child with autism and a child with ADHD and anxiety both might have social problems, but we might come at it, we would come at it a different way. We might recommend a social skills group for both of them, but the one with autism would, be focused more on that kind of reciprocity piece versus the one for a child with ADHD and anxiety would focus more on the anxiety piece and the kind of stop and think techniques. So, really the treatment approaches are different. So it is an important thing to distinguish. And I think that someone who is specialized in autism is in the best position to be able to make those distinctions.
Okay. I see a number of questions about if we recorded this talk and if we'll be posting it anywhere. So we definitely record every webinar and post the recording as well as the slides on our website, which is sparkforautism.org. So you can stay tuned. Those usually go up within a few days. Ericka, you mentioned a lot about children, but would you recommend any, or do you have any recommendations for resources or research studies on ADHD, autism, and executive functioning in adults?
Good question. So I think anyone who is a consumer of research knows that the research on adults and autism is also an area where there is a very growing area at the moment as we are, as that population is growing. And so I think that certainly there is evidence to suggest that these executive functioning difficulties continue on past childhood, and that they do have an impact on adults' ability to, sustain employment, to live and manage things, their, independent life effectively. I would say that similarly, some of those accommodations and a lot of these, I will say it too, a lot of the programs that I went through, I did put the child manuals up, but there are manuals in several of those programs that are geared towards adults too. And so there are resources there. I think, apps and, I always say I can't live without my Outlook calendar. Those things, are helpful as well.
Okay. So do you have a general number of the percentage of people with autism that also have a diagnosis of ADHD? I know the numbers differ according to where you look.
They do. They differ quite widely, actually.
Yeah.
So I think that that's still something that's trying to get pinned down.
Mm-hmm. Okay. Let's see.
But I will say, I think it, I think it's not rare, for
Mm-hmm.
sure.
Can you talk a little bit more about medication? I know you briefly mentioned it, and I know you can't provide, specifics, but could you maybe elaborate a little bit more on medication and ADHD and autism?
Yeah, I mean, I think I like you said, I don't want to provide specifics, certainly, but I think that, there can be a lot of benefit to medications. I think it's certainly a personal decision a family has to make, a parent has to make. I typically guide families in that direction to seek a medication evaluation when I see that a child is really struggling, and they're struggling because of a skill or a behavior that I know can be treated with medication, that there is evidence that there is a medication that could help that behavior, and that's really what's getting in their way of using all the wonderful abilities that they have in a more in an easier way, essentially. And so there are medications that can help some of the behaviors associated with ADHD and or autism. And there are different kinds of medications too. So there's a lot of, there are a lot of different options, and having a really open discussion with someone that prescribes them kind of helps, I think, unlock some of that mystery of medications, and the fact that there, can be side effects, and that's scary for any parent. But, thinking about kind of the big picture and in the long run what's going to help your child kind of be most successful in the end, it might be something that is worth considering.
Okay. Do you know of any research, or do you have any insight into services offered in the school depending on whether you have an autism diagnosis, ADHD, or both? Kind of, do you know like what the differences are? Are there benefits to having both?
Well, the school is mandated to provide a child with the services they need, regardless of what educational classification they fall under. So I don't think, it's beneficial, other than it helps, further indicate what the child's needs may be. But really, those should be defined, as I said, beyond just a diagnosis. They should be defined by an evaluation of that individual child, and then monitoring to see how the child responds to those interventions. Because we can, do an evaluation and try and predict what's going to help this child, but if in, the reality it's not, then we need to rethink what we're doing.
Got it. That makes sense. Okay, so we are at 1 o'clock, so I do want to wrap things up, but thank you so much